Initiative webinar series. Gamma Pi is a local chapter of Omega Psi Phi that's located here in the Prince George's County area of Maryland. Today, we'll be having a conversation with the ARC of Prince George's County. And the two guests that we'll have who will be leading this conversation as our facilitator will be Ntuma Kamara. Ntuma serves as a resource navigator for Project Live of the ARC Prince George's County. That's a nonprofit organization that's dedicated to supporting individuals with intellectual and development disabilities and their families. She joined ARC in December of 2024 as an outreach coordinator for Project Live. And I think this is SAMHSA funded initiative that strengthen mental health and transitioning support services for youth and young adults with disabilities in Prince George's County. Before joining Project Live, Ntuma spent 2 years providing childcare to families across the DMV, circulating meaningful relationships and supporting children's social and emotional developments. She earned a master's in public health from the George Washington University in 2024. Um, Concentrating in maternal and child health. Ntuma work is fueled by her Christian faith and deep commitment to serving the most vulnerable. Also, we have Lauren Lois, who serves as the outreach coordinator for Project Live in the ARC Prince George's County of a nonprofit organization, as I just mentioned, committed to empowering individuals with intellectual and developmental disabilities and their families. In her role, Lauren strengthens community partnerships, supporting families and providing engagement and expands access to mental health and transitional services for youth and young adults in Prince George's County. Lauren brings over 4 years of experience in public health coordination and patient advocacy. Through roles in clinical and community-based healthcare settings. Prior to joining the ARC, she serves as a medical assistant at the Waldorf Women's Care. I think this is Amoretta Transcultural Health Center. She has delivered trauma informed support, facilitates preventative services, and helps reduce access for diverse patient populations. So please join me in welcoming these two guests as we begin our conversation this morning. Thank you.
Good morning, everybody. It's a pleasure to be here with you guys today. I just want to share my screen. I have a few slides that I want to present before.
You guys here?
Yes. Can you hear me? Can you guys hear me?
Yes.
Okay. I'm gonna share some slides that I want to present first. Okay.
Hello? Let's see here.
All right. Can you hear me?
Yes.
Okay. So as he did say earlier, my name is Lauren. I am the outreach coordinator here at the ARC for Project Live specifically. So first, I just want to go over the ARC in general. The ARC is a nonprofit organization that promotes and protects the human rights of people with intellectual and developmental disabilities. We actively support the full inclusion and participation of individuals with disabilities in the community throughout their lifetimes. And we do this by providing them with wraparound services and supports that are person-centered or tailored to their specific needs, and by connecting them with resources in the community. The ARC has been the largest provider of services to people with disabilities in Prince George's County for over 70 years. All right. So some of the supports and services that we do provide include day programs and community living for our adult clients who have a waiver for services through the Developmental Disabilities Administration or DDA. The ARC is a DDA provider of services. Our day programs occur in and around the community. We have a meaningful day program called Bridges, which largely occurs at our McCormick office for individuals with more medically fragile conditions. It offers great opportunities to engage in enrichment and self-development activities with support staff on hand. Community living is our residential program, which provides housing to our adult clients along with personnel support as needed. We also offer employment services where individuals receive assistance with getting and maintaining jobs or starting their own businesses. And additionally, we offer autism waiver support and a plethora of transition youth services, which we'll discuss later. So just a quick overview of Project Live specifically. Project Live stands for Living with Intention, Vision, and Empowerment. It was birthed out of our mission to see every young person to be empowered when they leave school. So Project Live is our mental health initiative that provides free mental health screenings and therapy for transition age youth and young adults with disabilities. This is a great tool that helps students learn to communicate their interests, personal and preferences, and emotions in a safe space and in a way that best expresses themselves. We also offer behavior support through our certified behavior analyst if needed and resource management. So if you are interested in your loved one participating, just feel free to reach out to us at the email on the screen, healthytransitions@thearcofpgc.org, so a referral can be made for your loved one to our therapist. We also offer mental health trainings to providers, families, and community stakeholders because we do want to reduce the stigma surrounding mental health, and we want more mental health providers to support people with disabilities. Secondly, I just want to go over our Benefits Enrollment Center, often known as BEC. This is one of the key services at the ARC. We encourage every parent of an individual with a disability to go through BEC. It is especially critical that by the age of 18, you bring your loved one to our center. So we help screen, educate, and coach you on the application process for programs and benefits requiring certain eligibility criteria to be met. But the earlier you come, the better. BEC helps you plan for the good life for your loved one, which is our goal for transition planning. So it's never too early to come to our center and talk to one of our navigators. The last program I'm going to be talking about is our Ready at 21 program. It is our pre-employment transition program for youth and young adults ages 14 to 21. So it's the prep work for people to understand soft skills, how to communicate with their employer and peers, how to speak up for themselves when they need help or ask for accommodations, how to arrive on time, dress professionally, and so on. We focus on career exploration and opportunity for them to explore and learn what they may like and want to do for employment. So to join this program, you must be receiving services through DOORS. If you're already receiving services through DOORS, if that's already the case, we do need you to contact DOORS, let them know that you're interested in participating in our Ready at 21. And then also, as I mentioned, our BEC can help you with this. So our program offers work readiness training and career and post-secondary exploration. And then I do just have a couple of events that are coming up. So we have our parent tea time, which is kind of just a space for caregivers to get together and kind of have a session, debrief, learn some things. So our sessions coming up are focused on female caregivers. So if you are a female caregiver that focuses on caring for a female with disabilities, they are talking about promoting wellness, education, and empowerment. It is going to be with Dr. Gladys Wilkins. So you can scan any of the QR codes and we can send this in the chat as well. And then we also have our brunch bunch, which is in January 22nd. We are going to be going over advocacy in action. And we can send out all of these flyers. And then we also have our advisory council board. So if anybody wants to join or is interested, we can send that information out as well. That is it for my presentation.
Are you guys able to hear me okay now?
Yes, we can hear you.
Okay. Yeah, so I sorry for the technical glitches on my end here. Is it okay to jump into the questions, or is there something else that you guys wanted to cover from your end as well?
We can jump right into the questions.
All right, thank you about that. So I guess and again, forgive me because I had to log back on here, so I do apologize to you all as well as our listening audience. I believe, did you just give the overview of ARC and how you work with the community? I believe that's what I was hearing.
Yes, that's pretty much
Okay.
what we did.
Okay, so and did you also cover some of the most common disabilities? Is it okay to kind of jump into what are some of those common disabilities you work with, as well as the challenges that your clients or your patients may experience who need adequate assistance?
Right. No, we didn't touch on that, so we can definitely
Okay.
jump into that. So again, it was a little loud, but it's
Yes.
okay.
Yeah.
The ARC Prince George's County does service individuals with intellectual and developmental disabilities across the lifespan. So we work with you from birth, from when you receive that diagnosis and until the end of life. In terms of the disabilities we service, it's pretty wide. We, by and large, within Project Live, but I'll expand out. We see people who have autism diagnoses. We see people with cerebral palsy, Down syndrome, people with vision impairments, you name it. If you have a diagnosis for it, come to us and we will do our best to connect you to federal and state and private benefits, because the goal of the ARC Prince George's County is to wrap around the individual services that will help them to be thriving, prosperous individuals, members in their communities. So those are just very brief list of the people that we serve or the types of disabilities that we serve. But again, even if you're not sure you have a disability, come to us and we will do our best to wrap those services around you.
Okay. And so I'm kind of going to skip over the third question that we had here, because you just kind of covered that in what you just stated. But I would like to take a step back, and maybe I may have been the only one who missed this. But let's say that a family finds that they're gonna give birth to a child, or have already given birth to a child that needs your services. How do they generally find out about you?
Good question. Well, firstly, because I think this kind of goes back to one of the questions you had for us, which is we are constantly in the community. And Lauren and I, we are actually in the outreach department at the ARC. So we are constantly at schools, vending at different events in the community, trying to get the word out about our services. But we also have a website, the ARC of pgc.org, and that lists all of our programs, amongst which is our Benefits Enrollment Center, which we encourage all families to come to, so that they can understand, again, those state and federal benefits, Social Security income, Medicaid, SNAP, which is more so for people who are ages 22 and older, Lifeline, all these benefits. We want you to come to us through our Benefits Enrollment Center and sit down with one of our benefits intake specialists, so you get an understanding of the benefits that are available to you and the process to apply for those benefits. And again, that can start the moment that you receive that disability diagnosis.
Great. Okay. All right. So let's move on to one of the next questions we have here that I'm sure is directly in your wheelhouse. Some of the services you provide. So when you look at autism tends to be one of the most visible intellectual disabilities, certainly in the media. Can you speak to how the criteria has changed? Would be the first part of the question. And the second part would be, as a grassroots level, are you seeing more greater numbers of people each year with intellectual disabilities, or just more recognition and awareness that is kind of like coming to light, and those who are seeking assistance?
Right. Yeah. So I can't necessarily speak to the change that's involved in how autism has been viewed, being a relatively new individual to this sphere of work. But I will say that obviously there's been such great awareness around autism and just different intellectual and developmental disabilities. And I think it's largely the work of families, the work of advocates, the work of organizations like the ARC Prince George's County, putting these issues in front of key stakeholders, so that they so that they incorporate these individuals into the laws that they're making, and garner resources, services that are accessible to them. I would say with the ARC Prince George's County, we are just engaged in efforts. Our social media is constantly flooded with different flyers, different service announcements, or what have you, really trying to speak to and again garner attention around intellectual and developmental disabilities like autism and removing the stigma that's attached to that. And we're also partnering with different organizations, again, to amplify the voices of people with IDD. One of the key work that we do at the ARC is making sure that individuals with disabilities come to the table. So recently, in this past year, we encountered issues where, with the budget, where they were going to cut significant amounts of funds from the Developmental Disabilities Administration, which is the key state agency that funds services for individuals with intellectual and developmental disabilities to live and work and just get around, explore in their community. So the ARC was instrumental in gathering families together, consumers of our services together, as well as other key stakeholders, and going to council members and making the case for the importance of funding for these services so that, again, people with intellectual and developmental disabilities can thrive in their communities. So I hope that answers your question. Again, I can't speak to how the landscape, has changed in terms of the visibility of autism per se, but I can say that awareness is being generated, and that is not accidental, because we want to be sure that people with autism, with any other disability, voices are being heard, and they are having access to the services that are needed.
Great, thank you. And sorry for that. I was just trying to hardwire you here so I can minimize some of the issues that I'm having on this end from a technical perspective. But the next question I have to ask you, as I work closely with healthcare professionals, so I did want to know, do you guys actually work close with healthcare professionals? Kind of like, what's the scope in which you work with them? How have you been able to garner partnerships with them to benefit the community and those whom you serve?
We do, but I'll actually turn it over to my colleague to share a bit about that.
Yes, so we definitely do work with healthcare professionals and providers. We actually do have a lot of in-house specialists. So we have nurses and on staff in our Bridges program. As I said earlier, that is our day program. So they're largely at our McCormick Drive office. They work with our individuals and clients personally. We also have board-certified behavior analysts that come up with behavior plans for our clients. We kind of work with them closely as well. We tell them what's been going on. They communicate with us and let us know how they've been handling things and working when we're not around them. And then we work together to kind of create a plan moving forward that would benefit our client best. We also have mental health therapists, especially in our Project Live program. We are a mental health initiative. So we work closely with a mental health therapist. We do have one in-house. She does virtual appointments and in person. So they see them roughly once a week. But she works very closely with our clients, and we work closely with her, like I said earlier, kind of just to make sure that we're on the same page about our clients and just doing what's best for them, trying to promote their well-being, maximizing the resources that we have so that they can get the best outcome.
Sure.
Then we also, like that was the information exchange I was speaking of. We do training, and then we're also planning on working with graduate level programs, so like nursing students, PA students, kind of just so that those individuals with disabilities can get used to being around healthcare professionals in that capacity, and also so that our healthcare professionals can be used to servicing those with disabilities, reduce that stigma and make them more comfortable so that when they are certified, when they do get their licenses, they kind of have been in that situation already. They know how to care for these individuals. It's not new to them. They can educate their partners and their colleagues, and then kind of just, promote well-being, reduce the stigma, and ensure a healthy life for them.
Okay, that's fair. So, what are like some of the most prominent and impactful programs that you've worked with?
Yeah, good question. And I think all of our programs are impactful. They're all
No,
needed
I'm
because
sorry, not your programs, but some of the programs that you work with in terms of like a partnership. So it's kind of like a leading question, like if someone wants to reach out to you as well and offer some assistance, proper resources. Like, what have been some of the programs that you have worked with, prominent programs that you've worked with?
Okay. In that case, I would say we certainly partner with quite a lot of programs, private as well as state agencies. As we mentioned before, we because we are a DDA provider of services. DDA stands for the Developmental Disabilities Administration, and again, that's the state agency that provides funding to individuals with IDD diagnosis to receive services in their community or within their home. So whatever they need to toward independence, DDA would cover through funding. So of course we partner with them. We want to make sure that people know about the different services that are funded through DDA that we offer, which include our Meaningful Day programs, residential services, and employment programs as well. We also partner with DOORS, which is the Division of Rehabilitation Services. DOORS is the state agency that does all things employment for people with intellectual and developmental disabilities. So we actually at the ARC have a Ready at 21 program, which is funded through DOORS. So that's, we want DOORS to be sending their clients to us to take our Ready at 21 program, which really focuses on developing those soft skills in people ages 14 through 21, so that they are ready to find employment if they so decide that that's the path they want to take after high school. Through Project Live, we have certainly been extending our outreach to different community organizations, firstly mental health organizations, and really just trying to establish referral pathways between them and our program. So usually we'll, when we are at different community events, we are going around talking to vendors, different businesses, and inviting them to meet with our team, to tell us about their services. We tell them about Project Live. And the hope is that if they come across somebody with an intellectual and developmental disability who they can't serve for whatever reason, they'll send them our way so that they can utilize Project Live services and get that extra buffer of support with connecting to different state and federal benefits. And while I'm on that note, I will say that things have certainly changed in that we see more more organizations willing to work with people with intellectual and developmental disabilities in that mental health space, but still lacking the capacity to support them. So that's why Project Live, we're so happy to have this program that does that, but we are also wanting to train different mental health organizations, different therapists to be able to service quite well the vast array of diagnosis, dual diagnosis that can occur alongside that mental health diagnosis for our population.
Yeah, thanks for sharing that. And this is a bit of like an impromptu question, but I hope you don't mind, but it's something that made me think of when you say you know how you have other organizations who are willing to help people with disabilities, but maybe they don't have the total resources to support them. And kind of like what that made me think about some of the employment opportunities. That you'll often see folks with disabilities who are getting employment opportunities, or employers who want to hire folks, or people with disabilities. Just wondering if you can, and I know it's a bit kind of like off script, but can you share like how that kind of works out for those with disabilities, and how the employer is able, what challenges the employer may actually face, if any, and if you guys support them, and if not, like how are those with disabilities supported in an employment or work setting?
Great question. Yeah, I mean, it is a great question because it is very relevant for this population. Again, the good thing is that Maryland does offer that DOORS, the Division of Rehabilitation Services, and that's their key role, is helping individuals with disabilities by providing them with the accommodations they may need while on the job. So they may provide like a job coach to come alongside the individual while on the job. With the ARC, we do offer that employment support services, supported employment services, which also kind of work. I want to say it falls under the umbrella of services DOORS funds and DDA funds. And it's, again, back to that goal of not only providing that on-job support, but also helping the individual find a job. Because I think before we even get to the job, that aspect of finding work can be pretty tough for this population, because sometimes they're missing those socialization skills. Of course, there are some who cannot communicate verbally. So they may need support in doing that. They may not have the experience coming out of high school. And so there's just a lot of barriers that can be involved in that. So the ARC certainly does, through its supported employment services, help with resume building, interview coaching. Of course, our Ready at 21 program, which is, again, geared toward people ages 14 through 21, and more so students within that age range, works on building those soft skills of how do you ask for help while on the job? How do you relate to your coworkers? How do you manage your time, on the job, and things of that nature? So we still got some ways to go with providing supports to our population in that area, but there are definitely some supports that exist to help them, because they, like anyone else, want to work, right? Yeah. And even for people without intellectual and developmental disabilities, that whole process of finding work, especially in this job market, is so hard.
That is absolutely true.
Oh, yes. And I can attest to that. So
you're not the only one.
Where we can.
You wouldn't be the only one. But I mean, I think that's great. And that's great to know. I'm sorry for going a bit off script on that one. So I guess the other thing I could gather from from this conversation, and you can certainly confirm or deny, if you will, is that if there is a person who's suffering with disability, and they can also reach out to you guys for that employment assistance or support.
Yeah,
absolutely. If they're working. And the other thing I guess I would ask, so if there was an employer who wanted to employ someone with a disability, could they also reach out to you to find proper candidates or candidates that fits that criteria?
That's a good question. I don't, because that's more so the adult services parts of things
Okay.
at the ARC. Again, that
Okay.
supported employment program, they would know how best to engage with employers at that end. But in
Okay.
terms of Project Live and the clients we have, if there are anyone on this live stream who's looking for an employee, please contact me, because I have a few candidates who are wanting to work. As long as you are able to provide those accommodations, we would be more than happy to send them your way. Because Project Live, yes, we have that mental health piece of connecting our clients to a mental health therapist, but we also are, as the resource navigator, I'm constantly out looking for resources for them, whether that's towards employment, towards recreation. Again, it goes back to that wraparound service piece, because we just want them to thrive and be confident adults in their communities. So yes, absolutely.
Well, I think that's great, and I'm certainly learning a lot, about ARC. I know that there is one. I'm originally from Baltimore, and I had a friend who worked for ARC.
Mm-hmm. Yeah, we have many chapters.
Ago. Yeah.
Yeah, many chapters. Of course, they all vary in their personality. So some of the programs we offer, they may not necessarily offer.
Okay.
But the essential piece is us providing those wraparound services and connecting individuals and their families to those state and federal benefits that exist, right? SSI, Medicaid, SNAP, and whatever else.
Yeah. And so I think I know the answer to this next question, but I have to ask this, right? It's one of the $1 million questions. Are your services free?
Take it away, Lauren.
So we definitely do make it our mission to make services at little to no cost. So like we said earlier, we do get a lot of funding. So the services would be free due to grants, funding, other services like that. We do have our BEC. We'll send that flyer as well in the chat.
You said BEC?
Yeah, the Benefits Enrollment Center that I was speaking about earlier. If we don't have that in the chat, we'll send that. But that's basically where they go to get assistance to applying to these programs. So applying to DDA, applying to DOORS, applying for SNAP, applying for Medicaid, applying for these things that they can't get funding for. Like I said, Project Live, free mental health resources, free mental health therapy, all that is free. We do offer funding for families when they're available. So we have some scholarships, we have summer camps, stuff like that will all be free to them.
Your scholarships will be aligned to what particular opportunity?
So it wouldn't be, and correct me if I'm wrong, Intima, our personal scholarships, but organizations that we work with, they have some scholarships going on, and they'll reach out to us and we'll let families know. We'll reach out to them. They have this scholarship that you can apply for, that you can get funding for, just stuff like that. Not a direct line.
No, I mean, the funding is geared towards what? Is it educational services? Is it additional nursing services, or all of the above?
Yeah, it varies. Of course, it depends on, we're constantly looking for grant opportunities that aligns with what we are doing at the ARC. We have so many different programs because, again, we're just trying to target as many aspects of life as possible. So Lauren mentioned, for instance, our summer camp funding. That's through a grant that we receive, and it provides upwards of $500 to individuals between the ages of 5 and 21 to spend at any summer camp.
Nice.
And the goal is obviously providing respite, a break to caregivers, while also providing that recreational piece for their young person. So that's one of many grants we provide. If families are going through a hard time, of course, given that their loved one has an intellectual and developmental disabilities, and if funding is available, we do offer a 90-day case management for them, which includes the purchase of certain needed items for them to help them through whatever hard time seasons that they're going through.
Okay, great. And so the other thing, right? So there was a question we had about long-term facilities, but I don't know, do you have clients in your age bracket that are in long-term facilities? A, and then B, if there's someone who's not in a long-term facility in let's say in home care, if you will, if that term is correct, do you guys help with like any funding, financial services for nursing services? If a patient or a client needs a higher level of care in a home setting or either in a long-term care setting?
Okay, good question. I'll do my best to answer that. Again, I might have to refer to the adult services side of things at the
Okay.
ARC, because with us, we work, the programs that Lauren and I touch are geared towards transition age youth and young adults. So, more so people in high school, that high school range toward early adulthood. And that's like Project Live, Ready at 21. We have another program called Ready for Advocacy. And so with that population, they're still in school or maybe transitioning out of school. And our goal is just to make sure that they're not moving from school to the couch, right? Just sitting there because, once the school bus stops coming, they stop interacting with friends because maybe they don't have a mode of transportation. They rely on their family members for transportation. And again, those social skills may be lacking a bit. So that's where our transition youth programs come to connect them to different recreational opportunities in the community, employment, the skill development opportunities, what have you. In terms of that long-term care facility, I would say if they come to me asking, well, for assistance with that, that's where we would direct them to DDA, right? So they can obtain that funding to use to either find residential housing or what have you.
Okay. Well, thank you. All right. So we're at about 10:37, almost 10:40. So we also have some questions that have come in from our listeners and our viewers. You guys okay with me opening up these questions here? Or I believe you may be able to see, you can kind of like go through some of the questions you may want to answer. How would you like to do that? Would you like for me to read some, or would you like to go in and look at them?
You know what? You can read them and we'll do our best.
All right. Okay.
Do our best.
So let's take one of the first questions we have here from one of our chapter members. You guys may have answered this. Let's see. What are some examples of small challenges organizations, business, schools can make that have had a big difference for people who you serve?
Good question. I guess in terms of your interaction with people with intellectual and developmental disabilities, I think the first and foremost thing is staying informed, really reading on different disabilities, people with different disabilities, but then steering away from making assumptions, right? Because these manifest so differently in different individuals. But then once you have that information, just taking small steps to make sure that your school, your business does have some kind of accommodation. We know with people with autism, for instance, they have, and the name escapes me now, but they tend towards, those fidget toys, anything that can help them tactile experiences. So maybe having fidgets in your office space. That's something we've tried to incorporate in our office space for our visitors. So, making those small changes just to make sure your environment is welcoming, it's inviting. Of course, there's also a thing with harsh lighting for certain people with disabilities. Of course, making sure if you can afford to have a accessibility ramp, for individuals frequenting your location, that would be helpful as well. And then too, we invite you to join us in advocating for positive changes so that, funding are going where needed and people are having access to amenities in their communities. The ARC, again, is an advocacy organization. So we are out there during the legislative season and whenever else we're needed, advocating for these positive changes.
Okay.
So join us. Absolutely.
All right. Thank you. We're going to take another question. We're going to take another question from Matt. And I think you're able to see this on your screen, maybe. I'm not sure how good of a job I'm doing with this. But it's without sharing and identifying details, could you please tell us about a recent success story that captures what ARC is all about and why you're proud to do this work?
Ooh, oh goodness. That's a good question. Lauren,
I think you were working on them yesterday. I don't know.
Do you have any stories that come to mind?
I would say not specifically. I know we just did a testimonial. I was about to look for it really quick to put it on the screen. Let me see. I do know, I'm pretty sure, I want to say a couple of our clients just, I feel like they just got employment, I want to say, which is very good. We love to hear that when they get paired. But let me see if I can find the testimonial because I really loved it. I know our supervisor, the CEO of ARC really loved it. So give me 1 second.
Okay.
All right, that's fair. We'll move on to another question from George.
Sounds good.
And his question is, what practices, policies at the county, state, or federal level needs adjustments? You probably have a list for that. Adjustments in order to alleviate some of the challenges faced by, I think it's by differently abled people. I think it's probably disabled people.
Mm-hmm. Yeah, I mean, I think George, your language was spot on there with the differently able. Again, this is something maybe my supervisor or somebody who's been in the game can best articulate.
And can we pause here? Because I think this may be a teachable moment or certainly a learning for me. So differently abled. Let's focus here. So I thought it may have been a typo and said disabled. So is the verbiage that we're now using or that should be used is differently able?
One of several. I feel like it's constantly changing, but again, we want to move toward empowering language, than what I guess stigmatizing language or what have you. I feel like disabled is maybe that falls under that category, but differently able, yes.
Okay.
That's a step in the right direction.
So, I like that. And George, if you're listening, I apologize for saying you may have had a typo. that's my ignorance. So I sincerely apologize. But please continue, Intima. I'm sorry.
Oh, sorry. I think Lauren had something
to add to that. Yeah, I was going to say, just to add to that, for example, when we're speaking, like now we want to move away from saying disabled people. Maybe you would say people with disabilities because, that disability doesn't define them. So it's just something that's a part of them. It's not, when you look at that person like, they're disabled. Like that's not the first thing that's on your mind. So that person that has a disability, like that person that is wearing that red shirt, like it's just a minor, it's just a part.
No, I agree. I totally agree with that. And I appreciate that learning for myself because they are able to do a number of other things. So when you say disabled, it may imply that they just cannot do anything to use a term. I don't even want to use the term, but the term came to mind was an old school term called vegetable, where you really can't do anything, but that may not be appropriate in this day and time. And I certainly don't want to speak or speak, offensively to anyone out of ignorance, but I do like that term differently able because you're able to focus on the abilities that they have. So thanks for putting that in there, George. And thank you for reiterating that word, Intima. I appreciate that personally.
Thank you. Absolutely. And look, it's a learning opportunity for us all. We're constantly learning. So we know no harm was meant at all. So that's good.
Yeah. So it looks like that's all the questions that we had in the chat. Any listeners, viewers, if there are any additional questions you have, please pop them in the chat while we have a few more minutes here with these lovely ladies from ARC. And we do have about 15 minutes remaining. So I'm not sure if there's anything else, maybe off the cuff that you'd like to share. I don't really have any more additional questions. I don't want to ask too many questions that it's kind of like, that are outside of the scope. But I will tell you that I feel very appreciative for being asked to host this call, facilitate this call, because I can tell you that I've learned things, and being in this space and working in the healthcare industry where things are ever evolving. I think it's really important to use the current terminology, the proper terminology, and to have, just the best and most up-to-date knowledge and experience when working in this space, and not to do anything off-putting. Always look for some opportunities in which you can help anyone from a healthcare perspective.
Absolutely.
This would be a whole different conversation, but as we know, there are a lot of healthcare disparities, particularly in the African American community. Not that they aren't in others, but for this call and for what we're doing, I would venture to think that it's mostly African Americans that are on this line. Certainly the fraternity, is an African American based organization. I just think that's important that we broaden our scope and we look for how we can help minimize any of these disparities, particularly in this community. And as we're talking again, Prince George's County is predominantly an African American community. So,
Absolutely. Can I ask, what do you do in healthcare?
so I do pharmaceutical sales.
Oh, okay.
Yeah.
How long have you been doing that for?
Since 2006. So I left the field for a little bit, worked in corporate, and came back into the field. And in this particular space, I'm working in HIV prevention,
Oh, wow.
which that's another space where, of course, disproportionately affected in terms of not getting treatment or either taking prevention. But again, that's another conversation. But yes, I've been in the healthcare space for some time now, from a pharmaceutical sales and marketing perspective.
Mm-hmm. Okay, sounds good. Well, thank you for sharing that. I do want to encourage your audience. If you know anyone who, has an intellectual and developmental disabilities, may not know about the ARC. Sometimes we hear that people don't know we exist, but that means we got to stay out there, right? And take our services out there. So feel free to stay connected with us on social media. Our handle is at the ARC PGC. Did I have that right, Lauren? On Instagram and Facebook. We constantly have, I would like to think of ourselves as a fun organization. Again, it goes back to that engagement piece, making sure people have meaningful days. So we are constantly hosting events. Soon we'll be planning our Ready to Be Healthy festival in June. So planning will begin at the start of the year, and that's like one of our biggest events. It's open to all community members. We have different vendors come in, different organizations. So Parks and Recs comes, Maryland Able comes, which is like an account through the state for people with intellectual and developmental disabilities towards long-term funding, or long-term savings rather. Just different recreation vendors around the community, and anyone with information to share with our population. So stay on the lookout for that. We'll be doing the countdown on our social media to June. And
where is it going to be in June?
Good question. So typically it occurs at our 1401 McCormick Drive location. We use our parking lot as our playground for that day. Okay. So that will be there. If, as far as I'm aware, it will be there. But if there's any changes, we'll be sure to post the flyers and all that information on our social media page.
Definitely, please let us know.
Okay. Actually, you guys come out and help us the day of. I think 3 members of your fraternity come out and assist with setup and takedown. We greatly appreciate your strength. So please help us, because we are great. The ARC is we have quite a lot of women on our team, and hey, that's wonderful, but we also need some male energy the day of for that.
Great. I just recently joined this chapter as I moved out here in this area, and I was going to ask you, and I think you kind of just answered that question as well. What kind of ongoing support or partnership would you like to see with the chapter this particular chapter, Gamma Pi, out here in Prince George's County, if we could render that type of assistance and support. So I think the first one is help you in June with your setup.
Right, with different events that we host. Again, we have a caregivers retreat that just happened in October. Heavy equipment to be moved. Of course.
So, Antima, are you saying you only want us to come and help you lift and move things?
Well, not only, but that is we need your help in that area for sure. But that's not the only thing. Again, help join us in our advocacy efforts during different parts of the legislative season. There's something called, what is it called, Lauren? In January and February, is it Developmental Disabilities Day, DD Day, when we go to Annapolis and we take calendars to different legislators and, just try to get their attention on whatever issue is happening for the day. So we would love your presence there, because the more people that's there, the more they are aware that this does mean something to significant numbers of the population. And then, of course, invite us back. We would love to be back. Absolutely. Maybe we can talk a little bit more about our adult services the next time.
Well, Quentin is listening, so he's probably going to take a note of the adult the adult assistance that you guys provide, and I certainly will be there. And hopefully, if we do that again, I won't have the tech challenges I had in the beginning with the internet. It's like unbelievable. I've never had any internet issues since I've been here, but today, of course, was one. But I can tell you, I certainly look forward to having an ongoing partnership and relationship with you all. My focus, coming back or coming into this chapter is strictly going to be on all health initiative related focuses, whether it be health and fitness, hypertension, blood pressure, anything that's health related. That's going to be my focus and what I'll be working on. So, and I'm going to add this now as well, because this has been a space where I have not had a lot of visibility in. I've been aware of it, of course, but not a visibility. And again, I'm just so thankful for the one tip that I'm going to walk away with there and saying differently able. So I will not forget that. Let me see what Quentin just said here. Just sent me a message. Let's see. Okay, great. Got it. All right. You guys ready to end so you can have a little bit of your time back? But before we do that, Miss Lauren, you're going to be put on the spot again. Are you ready?
I am ready. I'm just going to share.
We are ready for you to end with that testimonial.
Yes, let me share my screen.
And then after, followed by that, you can certainly share any additional take-home points. We love to know, we love to have, and we love for our listening audience to be aware.
All right. Give me 1 second.
Take your time.
Okay. I'm just going to read it for you guys. This is from one of our parents/caregivers. They said, Project Live has been a blessing to me, Amber, and my entire family with their outstanding, experienced workers, the services they are currently providing to their clients. People like Amber and caregivers have been magical. I will never trade them for anything, and I would wholeheartedly support and attend any program that the ARC are providing, and I will refer people to the program. Project Live has helped my family extensively. What I like most is a lot of information has been given by Project Live, information about several services, several things that our loved ones need, loved ones with intellectual and developmental disabilities. So Project Live is the voice of the voiceless. They are truly God sent.
Great. Nice.
And I really like that testimonial because I think that just speaks to everything that we do. And even then, like we said earlier, say for instance, we can't help you specifically. So our program is for those ages
16 to 25. What's Project Live? Project Live.
who resides in Prince George's County. So even if they don't fall in between that criteria, we always are referring people out. So we work with other programs, just also outside of the ARC, inside the ARC. So we're always trying to refer people to other places. So if we can't personally help you, we are going to find somebody that can. So I like that testimony because I feel like it speaks to that. Take home points. I think Entuma really hit everything. I did want to add calendar day is going to be January 15th from 1 to 4 in Annapolis, and DD Day is February 18th.
Hold on, one more time. Calendar day is when? I have DD Day. Calendar day is when?
January 15th from 1 to 4 in Annapolis.
So that's coming up.
Mm-hmm.
Okay.
We need manpower and woman power.
All right. Well, I will send a message out. I think it's pretty much safe to say you can count me in on 115. I'm checking my calendar now.
Yay.
So I'll be there.
Perfect. Thank you guys so much. This was amazing.
Mm-hmm. You all have been a wonderful host. So thank you for your hospitality, and good luck with everything you all are doing with this live stream and with Gamma Pi.
Thank you so much. And I wish you guys the best as well. And we will be in contact soon. You get a whole 4 minutes of your Saturday morning back. Thank you again so much. I apologize for the issues in the beginning, but I do look forward to us doing this again and opening this up to the community.
Absolutely.
All
Take care.
You do the same.
Thank you. Bye.